Yeah. So what you can contribute to the US healthcare system, how healthcare is going to evolve in the future, and why should I take you into our program? Or why you amongst 2,200 applicants? So, like the first question is how, what can you contribute to the US healthcare system? Anybody wants to go with that? You can just turn on your mic and answer that question, because that's again an important and ethical question. Like it's related to something related to that. Okay, I'll just give one two points that I have in my mind is firstly, okay, that I can contribute to the US healthcare system is the fact that Rashmi, can you please post the question in the chat box? Okay, I'll just send that in group again. Right, it will be difficult for me to type it in the chat box. I'll just send that in group. Both, like, just give me a second, please. Forward and yeah, so I've just shared that in the group. What can you contribute to this? Okay, perfect. Yeah, thank you, Saraswati. So the first point that I have in my mind is, because we discussed this question in the previous meets as well, is firstly, I can just bring my experience working in different healthcare systems, where healthcare settings to the United States. That is my one point, what I can contribute to this. The second is I can bring my wide knowledge treating more number of patients with the diverse pathologies to the United States clinical, to the United States healthcare system. Yeah, so these are the 2 points that I can contribute to the US healthcare system. Anybody else have something to add?
Can you repeat your first point?
My first point is that I can bring my knowledge working in different across working in different healthcare systems in my home country to the United States healthcare. My experience working in different healthcare institutions in my home country to the US healthcare system. Second, what I can contribute is working on different knowledge treating different patients with the wide pathologies in my home country, bringing that knowledge again to the US healthcare system. So that are my 2 points, that what I can contribute to the US healthcare system. And anything you people have to add, like, do you have any other good points? Just free to answer. There's nothing wrong in this, right? There's nothing right and wrong. Every answer is right. You might have better points to mention, like, or something in your mind that you have.
I would like to add on that having practiced in India, where we have worked in settings with very limited infrastructure, we can work in the US. There are several rural pockets in the US as well, and we can cater to their needs accordingly. I mean, I'm not able to frame it properly, but I'm probably speaking along the lines what you have already said about contributing to the US healthcare because of our past work experience. Probably I'm just elaborating on that point.
So you basically mean you can bring that efficiency working in the settings with the meager resources, treating large number of patients in a less
Yes.
limited time to the US healthcare system. So you can add your efficiency to the US healthcare system. Definitely, that's again a good point. Yeah. Sidhu, you want to talk something? So the question is, if a PD or somebody asks you what you as a resident can add, or as a doctor, as an international medical doctor can add to the US healthcare system. So the 3 points that we discussed is, first, we can bring our knowledge, infrastructure. Dr. Saraswati, you want to say something? Like, what do you mean by India and the limited infrastructure? You could just talk. You can just switch on your camera and you can just switch on your mic and talk. Like we can just have your good point as well, because we need some more points, because what points I have, they are going to be very common points that everybody is going to mention.
Can we say that we can advocate for policy change? I don't know how to elaborate on that point, but I was just thinking this is something we have always wanted to do even while we are in India, right?
Yeah, even that I have in my point is, yeah, once we work in that setup, we can learn more about that, right? Yeah, we can just learn about that system, and definitely we can add to the policy change. That's even a point that we discussed in a previous meet as well, right?
Okay.
Like what we can contribute to the healthcare, because we have to come up with the points. Like even that's what I thought, that I can just say that I can gain more experience and understand US healthcare system better, and then I can just, be maybe I can take part in the policy as a policy maker. I can just work to make healthcare even more accessible to many people as well in the future. That is what.
Yes.
Yeah.
Working on improving the accessibility of healthcare
Under
to the underserved people.
universal accessibility to healthcare. Yeah. So the first point that we talked about is the efficiency. We can bring our efficiency to the US healthcare system, working in the settings with the meager resources, handling more number of patients in a very limited time. Secondly, we can just talk about we can just bring the experience working in different healthcare settings. Like somebody worked in different countries, somebody worked in different settings, maybe urban or rural settings. We can bring that knowledge. We can just bring that experience to the US healthcare system as a doctor. Thirdly, we can just yeah, as I told, we can take part in the policy making in future after experiencing and learning about the US healthcare system, and try to make it more accessible to the people, right, to everybody in the US. And the fourth point that we can talk about is that I can bring my anything you want to add. I just have 3 points in my mind.
The other thing maybe that we can talk about is that there's deficiency of like primary care physicians, and we're helping address that gap, especially with an aging population. So addressing that gap is important, and like we are like a qualified workforce who is ready to meet that gap.
That's a valid point again. That's a very good point. Yeah, there's a shortage of doctors, and as the population is becoming more older, we need more doctors. So we can just try to cover that gap. Yeah. So we have 4 points in our mind. Anything else anybody wants to add? Just be more creative and give us some good ideas. Dr. Bushra? Okay. So how are we going to proceed with the meeting? Like Dr. Harshita, you want to say something? Maybe we can put that too. And someone just told us about India and limited infrastructure with that liquid resource, so we can put that. Yeah. Dr. Harshita, do you want to say something?
Uh, so we can say like, okay, about how all most of you have some experience in India. You can say, um, since like we were like we are exposed to different working environments, and how do I put this? Um, we are able to we would be open to adapting to different work environments, and I think, I mean, and of course this would help us work anywhere in the US, irrespective of the setting, be
Yeah,
it rural,
exactly. Yeah.
urban,
You,
suburban.
yeah.
So
You just mean adaptability, that we, since we doctors working in a home country, we are adaptive, so we can just work anywhere in US. And definitely we can work to cover the shortage of doctors, primary care physicians in the US. Yeah, that's even a good point. And yeah, the one more point that I mentioned before is that we can just say we can bring our knowledge working on large number of patients with various pathologies that are known little in US. But since US is an immigrant country, so it can present with the new diseases in the future, and we can bring that knowledge to treat those cases. Join rate. So Dr. Sneha, the question is what you can contribute to the US healthcare system as a doctor, as an international doctor. So yeah, we just have 5 points to these questions. So should we move on to the next question, or do you want to discuss about something else?
Can we add a little about diversity? I mean, having come from, of course, this is only applicable to us who have worked in India. India is a country of diverse cultures. So, having practiced in a country with diverse cultures, we are trained to be more inclusive,
Yeah,
and we can be good at resolving racial disparities in the US.
Yeah, we won't say the racial, like I won't say in my when I
It
answer.
will be controversial.
Yeah, but that's a very good point that we believe more in like we are more inclusive of everybody, right? Because we have worked in a setting which is culturally very diverse, right? We can just mention that in the country where language and culture changes every 100 kilometers. So we are used to working in a very culturally diverse society, and we believe in that inclusivity a lot, and we can bring that to the US healthcare system. Yeah, that's a very
Okay,
good point.
good.
Yeah. Anything else? So should we move on to the next question? How healthcare is going to evolve in future? It's very difficult for me if nobody is going to answer. How can I proceed with the meet?
I can answer that, Ayushman.
Yeah.
So I think healthcare in the future will evolve in like hand in hand with technology, like whether we're talking about AI or whether we're talking about more advances in the EMR. I think there's a huge role for technology to play in the future of healthcare, and healthcare has been traditionally very slow to adopt to technology. So I think we as the next generation of healthcare leaders need to be aware of that and need to try to be more inclusive of technology and make it so that we use it in our day to day, and we can work in partnership with all of these technological advances.
Yeah, definitely. That's a very, very good answer. Yeah. So even I have one point that with the introduction of AI, we can definitely AI can work towards reducing the human errors in the healthcare, as well as it will help to make the healthcare more accessible to the people who didn't have access to the healthcare. So AI will try to reduce that gap in the disparity in availability of the healthcare, right? That
Uh,
Yeah, true.
Yeah, so yeah, even what Dr. Manasa mentioned, it's even a very good point. But yeah, this was a point that we discussed in a previous meeting. The second point that we can talk about, like I have, like maybe like in India is working on making the medicines cheaper. Like there's somebody by the name of Indrani Mukherjee, right? She's some CEO of PepsiCo or something. So she's working on making the insulin at a less than 10 cents, like one vial less than 10 cents, and to make it just accessible to everybody. So I can just quote that example and say that countries are working to manufacture medicines at a very cheaper price to make it accessible to everyone.
can you repeat your point, if you don't mind?
Sorry.
Dr. Manasa's point, because I had some issues with the speaker, so like of
Dr.
my.
Manasa, can you please repeat your point again?
Yeah, sure. Healthcare, I think in the future will be in partnership with technology, and especially whether it's AI or whether we're talking about advances in the electronic medical record. So there's a lot of room for us to include technology as we move forward in the healthcare landscape.
Okay, thank you so much.
Something to add?
Hi, Asman and everyone. I'm Sapta.
Go ahead.
I'm new to this interview sessions practice. But I want to add a few points. I think currently also and in few years, we are going to see some kind of revolution in biotechnological and pharma industries, and especially there are new emerging branch like medical entrepreneurship, medical leadership. Uh, these are coming in light along with our core clinical competency and clinical branch, which was not previously there 5 years ago. And another very eye-catchy point would be like using social platforms for healthcare management, for reaching to community outreach places, for I mean, delivering the right message, what we want to say to a larger group of people instead of just teaching or mentoring to a smaller people. We can use the social platforms for this. So this is something. And another working area is genetic makeup and genetics. A lot of research are currently going on in this field, so definitely it is going to enhance our lifespan in terms of human race. So this is something I think we can talk about. And also, as you have told about the vaccine, that insulin part, we all can talk about the vaccine part, because India has like taken a great part in delivering COVID vaccine in a very um,
Efficient
and
way.
India was kind of the leading country in delivering COVID vaccine to many other countries. So that way, yeah, it's going to this intra-country collaborations are more in this generation because of internet and accessible um, accessible, what I can say, communication thing, which was not there previously. So
Yeah,
yeah.
that's a very good point that like you told about the COVID vaccines. So like if I have to include that, so I would say that even Dr. Manasa told before, like I don't know exactly, like somebody just told that EMR is going to become more accessible. In that, I can just say, like in my home country, government of India and the policymakers are working on that, and they're trying to make it the accessibility to the electronic medical record system to a wider population. Like they created a database for the COVID vaccine to increase the efficiency of the delivery of the COVID vaccination to everyone, and everybody having the mobile phones the record of availability or record of getting COVID vaccine during the COVID-19 pandemic. So yeah, the more countries will come up with such technologies and make healthcare making like I don't know like what proper word has to be used, but I would frame it like this way.
And also, I just want to say, like, about AI. AI is all about data, and being from a overpopulated country like India, definitely India can use his population as a huge data for AI, which is definitely going to helpful for making policies, protocols, and for better sustainable healthcare in future.
Yeah, that exactly. That's a very, very good point. Yeah. Making the health.
That the country like US and other countries which are like smaller country cannot say, but we all can say, who are from India and other like China kind of yeah.
Yeah, but I guess they want to see your vision for United States since you are giving the interview for United States. So mostly they will prefer your answer which is related to the United States. And what I have seen during my observership in United States is that the future of the healthcare is going towards the preventive visits and wellness visits nowadays. Rather than curing the disease, they are focusing more on preventing the disease. And they have they are focusing more on the preventive measures. So you see now they have opened even a lot of fellowships for geriatrics and preventive medicine. So the future is going towards the preventive things. So this is maybe you can talk about in the interview, and that would be a great challenging point because they're expecting their residents to go into the preventive medicine fellowship after completing their residencies. Most of the community hospitals. So where I was working, last hospital where I was working, so I was working with APD and So his first question was, okay, so what are your future goals? I said hospitalist, and then he was like, "Have you ever thought about going into preventive medicine?" And then I asked him, "Okay, so what is the preventive medicine?" Then he was like, "So nowadays, U.S. healthcare system is focusing more on the preventive and wellness visits. Even they have Medicare and Medicaid wellness visits for old age patients." So, I mean, of course, you cannot, you have to treat the patients, but their focus is being diverted from treating to preventing now. So that's something that you can talk about, and they will think that you know about the US healthcare system, that where it has been driven now.
Very, very good point. Thank you so much, Dr. Suraj. Yeah, like I can just talk about like I when I was at Decatur in Illinois at a hospital, so I was rotating with the gastroenterologist. So there was like somebody coming up with technology, like they do the pap smear thing, like they put a tube. So for the esophageal cancer, they are trying to create something like a age screening appropriate tool where they can just put in a tube over there in the esophagus and the balloon. They can just outside attach it to a syringe and they can inflate a balloon inside and it will just scrap away the esophageal cells and that they can see under microscopy and make it more and they can just detect about the esophageal cancer. So like what I want to say is that even with the future, the coming technology for the preventive healthcare where they are trying to make procedures less invasive. So that even we can talk about that.
Yeah, I guess that's a very good point that it try to include both things like AI thing and the future technologies. So you have to merge technology with the preventive visits. Like there, day by day, there are a lot of technologies emerging through which we can their screening process. So screening things are also like preventive visits. And you see that any patient who comes like at 40 years age, they have a colonoscopy. If at 45, they have the colonoscopy screening, and for females, they have breast cancer screening. So you can include these technologies in the screening technologies, and along with that, you can add on your point for preventive and wellness visit. So that's where you can say that I see the future of healthcare is going towards this side, and it's up to date. And I mean, it's a very good answer to the point, and they cannot ask much from you. So if you give any new answer to them that's they are not aware of, then you have to explain them a lot of things. But this thing they are already aware of, and if you tell them this thing, so it will give them a point that okay, you are aware of the US healthcare system, that where it is going now.
Yeah, definitely. That's a very, very good point. Yeah, the
Mhm.
collaboration of the AI with the screening in our wellness and preventive visits. Yeah, that's a very good point. We can just stream it the way we want to. Yeah.
Yes, sorry, I have a point too. Like I had somebody talking about this particular thing. The person mentioned that a lot of people are getting anti-vax, that most parents they don't want to vaccinate their babies again because of what things that they feel might happen, like autism and other side effects associated with it. So I think and those diseases that has been eradicated might start re-emerging. Then that's one thing. Then the person also raised another point, that something about telemedicine, that maybe with time it might be the most form of healthcare.
Yeah, I think in US telemedicine was not that prevalent in earlier, but now it's legalized with the government over there. That's what I heard in one of my rotations that it was not earlier. It was not legal to do the televisits, but now after the COVID-19, it has become legal and its availability is increasing across United States. So I can even
Mhm.
mention like that's what I heard, but I can even talk about this like with the upcoming technology, the telehealth will take a huge proportion of the healthcare and will make the
Yeah.
healthcare accessible to everybody.
Mm-hmm.
Right, even the developing countries are coming up with this to make it accessible to everyone. The people who are underprivileged and live in the remote areas, they will even have the access to the healthcare to the telemedicine.
Mm-hmm. All right.
Yeah. So somebody just wants to summarize the points and then we can shift to the next question. But anybody wants to add something to this?
I can add one more point to this. The COVID-19 pandemic has significantly influenced public health preparedness, especially in the US. So there will be investments in public health infrastructure. There will be a greater investment in at a federal, state, or local level. So there will be workforce deployments, laboratory capacity, disease surveillance, and stuff like that. So that is one point you can add, that is definitely going to get an upgrade.
Yeah, that's a very very good point. Like after the COVID-19 pandemic has taught us to like definitely there will be more public health investments and the disease surveillance laboratory in like yeah. So definitely that's a very very good point for sure.
Yeah, you can expand on that, absolutely, that even the vaccines would be generated faster if something like this happens again. Even the research regarding it, the supply chain resilience, a lot of things can be added to it. But yeah, basically that.
Yeah, that's a very very good point. So like anybody wants to summarize all those points quickly, or we
So
should
yeah, I can summarize.
go ahead, Dr.
I mean, there are just four to five pointers that we have to remember in mind. So when they ask about where do you see the future of the healthcare, so you can talk about the advancement in the health technologies like AI is taking place. So that is going to make that is going to revolutionize the healthcare system, and advancement in the EMR system, and it's going to be more available in different countries as well, which helps doctors to um, put out the charts or any previous histories of the patients very readily. So that's one of the future of the healthcare. The other things that we talked about was screenings with the help of AI technologies, and the preventive and wellness visits. That's going to revolutionize the healthcare system, because it will decrease the burden of the disease. If we have more preventive and wellness visits, of course, it will decrease the burden on the hospitals. And with that, you see that okay. So there's one more point, that when you tell them about preventive and annual wellness visits, so you tell them that the future of healthcare is also going towards primary care more, because annual wellness and preventive visits are being taken in primary care clinics. So you can say that you see the future is going towards the primary care more and more, because we are focusing more on the preventive visits. So this is the fourth point we can say. And the fifth point that was told by Dr. Shah about the investment in the healthcare system, so that if we have any pandemic in the future, God forbid, any pandemic in the future, so we can have enough funds to make vaccines in a short span of time. But I guess the vaccine thing, it was not due to the funds, maybe, because the vaccine takes time. It is an error and trial and error process. So even if you try, you cannot make vaccine in 3 months, because it has to go through the process that we know already, that there are different processes before approving any vaccine. So even if we make even if we make heavily investments in the healthcare system, but it will not decrease the time spent of availability of the vaccines. But yeah, we can readily provide vaccine to the third world countries. That can be the effect of heavily investment in this industry.
That's a very very
So
good.
these are the few points that we
Shah
can
even focus like the last point is told Dr. Shah even wanted to focus on the preparedness. Like we can be well prepared for the future pandemic as well if we invest more on the public health infrastructure. That's what he
yeah.
even meant, apart from the vaccines.
Mm-hmm.
And Dr. Sapta even mentioned a very good point that as EMR will become more accessible in the developing countries, we'll have more data available, right? And
Mm-hmm.
better for the research, and we can come up with a better, screening techniques or even medicines that can definitely add to the improvement in the healthcare in the future.
Mm-hmm. So what do you guys suggest, that we should just stick to 2 or 3 bullet points, or we should talk about all these points? Because I feel if we talk about all these 5 points, it's going to be
Very, very
like
long.
interview is going to be confused that he's talking many things. So
That's
I
what
would suggest that
Um,
if you want to talk about, just like everyone can just choose 2 pointers or max 3 pointers. Don't take more pointers. Just talk about 2 or 3 pointers. That's it. Even if we have ideas, like if we discuss 10 ideas here, then everyone has an opportunity to take 3 best ideas from them and then talk about that. If you're going to talk about 4 or more than 3, they're going to be confused.
Yeah, absolutely, absolutely. That like what I feel is that for a question, I can just have 5 to 6 bullet points, so that at least I can just have those in my mind, so that when somebody asks me, at least I can come up with three, right?
Yeah.
I'll do that. There's no point mentioning all of them in the same question, because
Mm-hmm.
we don't want to just concentrate on the future of the healthcare, right? We just have to be
Yeah.
part of the healthcare system first, instead of talking about what's the future of the healthcare. Yeah. So for me, like how it works is to just have 4 to 5 points, and then at least I
Mm-hmm.
can talk about three in the during the interview. Like that's what I feel. I'll go with that.
Yeah, the better is for three actually, because I have watched a lot of videos on YouTube. So I like one video where he said that always go with the rule of three.
Three.
Whenever you are
90,
talking,
three, and
so
one.
just talk in a rule of three. Even if you are just telling them your qualities at the end, for example, if you're writing your letter of interest, and at the end, if you are telling him what you will bring to the table for the program, just tell them three things. Don't tell him four or five that I'm leadership, teamwork, blah blah blah. Don't go for four or five things. Just tell them three things and they will remember it.
Yeah.
So always go with the rule of three. In anything, if you're giving any example, just go with the rule of three.
Yeah, exactly. So it's 90 is to 3 is to 1 rule, that 90 seconds should be the duration. So you should just come
Yeah.
up with 3 points, and you can just explain one point with the example, unless and until they ask to explain some other point.
Yes.
Absolutely, absolutely. Yeah. So we are
Any
done.
Sorry,
with
what
other?
about the anti-vax stuff? That means you don't feel it's a good point or what?
I'm
So,
sorry.
The anti-vax stuff, like I said, that a lot of parents do not want to vaccinate their children again because of the fear of the complication like autism or other form of diseases that can occur as a result of that. So as a complication of that, a lot of diseases that has been eradicated may start
Mm-hmm.
re-emerging and like that.
yeah,
So I don't know if it's a good point.
it is a
So
very good point. Like, yeah, even those diseases can come. It's a very, very good point. I'm so sorry I missed this point because I was not
Yeah,
available. It is very, very
yeah,
good.
sorry. So that's like the downside to it, right? Yeah, I
Yeah.
understand. Thank you.
So if
okay.
So even there is one more point, as is like similar, like if the people don't undergo vaccination, we can have the evolvement of the diseases that today can be controlled with the vaccination, and we'll have to shift our
Mm-hmm.
care towards that. And in the similar way, like we are going to have the emerging antibiotic resistance in the developing countries because of the incessant use of the antibiotics, right? Due to the due to the use of the antibiotics in the developing countries, we can have the emerging diseases. So the more now in
Mm-hmm.
future, the our goal will be more focused on treating the infectious technologies more than the non-communicable ones, because of the
Yeah.
emerging antibiotic resistance, and even due to the anti-vaccination, like anti-vaccination drive of people who don't undergo vaccination right now.
Yeah, sorry, hello. I put in the chat box. I just typed it in one of the GPT chat boxes. So I just typed the future of the US healthcare system. It gave me a list of options which I've put in the chat box, so we can also pick some of them and add to our list.
Yeah, thank
Thank
you
you.
so much. Thank you so much, Dr. N.
NG, yes, NG.
Yeah, that's really comprehensive, NG.
Yeah, that's a,
Yeah, thank you.
somebody can just share that in group, or like we can just have it
I
with
can
us.
I can do that.
Sure. Thank you so much, Dr. Kumar.
Um,
I think Dr. Sapta also made a point about making health education more accessible
oh,
using AI. Am I right?
somebody already put it. Okay.
Yeah, actually, Dr. Sapta told a lot of valid, good points. But yeah, it was like she was a little like fast in telling, so we couldn't comprehend all those points.
Sorry, I can just summarize. Like I was just writing the points. First thing, like we all can definitely say about EMR AI because that is something about US. Like we can say we are using these techniques like for better health education, health management, and also we can use this data manipulation thing in this point only, like we can being a breach between developing and developed country, definitely we can use our expertise and data for better policy making in countries like US. So definitely we can use our experience for that. And another point, that preventive aspect, I think that is a very good point, because and we can use the points like screening and this COVID vaccines in this headline, like preventive aspect. Nowadays we are shifting our care more to preventive side than the curative, which was previously curative aspect. So another thing, I feel like this minimal accessible, like we can talk about minimal accessible procedure or surgery through using technologies and robotic surgery, which can, overpower, which can
Overcome the
um,
human errors. Yeah.
which can because US
Yes,
has
that's a good
less
point.
manpower, so we can talk about these techniques, like surgery like robotic, which will in future replace the shortage of manpower, so that we can use this
Yeah.
point. And another thing, what I have seen during volunteering and all, people are nowadays, the medical people are very rigid, and very streamlined to only patient care. Nowadays they are talking about medical entrepreneurship, leadership, and also using social platform for like reaching delivering, also management, for everything, for medical education. So we can use that point also. I feel like these 4 points are very useful points. We can add our own points also, like.
Yeah, you summarized everything again very well. Thank you so much, Dr. Sapta. And you even gave few additional points that we can keep in our mind. Like,
And if someone wants to add more, that will be like pharmaceutical and biotechnical industry collaboration. Nowadays, lot of research are going on in, especially oncology field, and especially like gene therapy. Gene therapy is a very high yielding topic, and also they're using this genetic trials, and USA is leading all over world. USA is leading, like recently I was working in a bone marrow transplantation department in University Minnesota. It is they said like they have done this trial, only 6% so far they have addressed all over world, like a side effect of gene therapy. So like maximum doctors are interested to work in gene therapy because it is one of the high yielding area right now. So we can talk about this pharmaceutical and biotechnical involvement.
That was really good. Thank you so much, Dr. Sapta.
so much. Yeah. So should we move on to the next question, or even somebody wants to add? Dr. Sapta, do you want to add something? What you can contribute to the US healthcare system?
Okay. Uh,
Like, as an international doctor, what you can contribute to the US healthcare system? Though we have come up with many points like previously, but even if you want to add something right now, or anybody else wants to add something, then we can just shift to our last question.
Yeah, let's shift to our last question.
Okay. Or Dr. Sapta, do you have something to add?
I think for me that last question and this US healthcare contribution, I think the similar answer. I think all these are kind of your strength. Like what you can add to healthcare system is why they are going to choose you.
Yeah, exactly. All of them are, to be very honest, interchangeable questions, and we can just answer the similar points in all of them. Yeah.
Yeah.
So, okay, we'll shift to our last question. Why should I take into our program? Or they can ask you why you amongst 200 or 4,000 applicants, why should I rank you as first, right? Or why should I keep you as my top choice for my program? So anybody wants to add that point, add something to that?
So basically, for this question, you will summarize all your strengths here, but again, the same thing, that only three things, rule of three. You will just tell three things, and for those three things, of course, you have, if you have a lot of strengths, 5 or 6 strengths, and if you want to tell more things to them, but you have to be focused on three things. So for that, first of all, you have to go to ChatGPT and just try to take those three buzzwords that relate to your personality. Okay, it's going to be changed for everyone. I mean, if I just tell her that, okay, I bring my 12 months US clinical experience and my previous leadership skills, and the third thing maybe any other third quality. So
Yeah.
if I just tell it here, it's not going to relate with everyone's answer because your personal statement and your volunteer work is going to be different. So in this case, I mean, we can make a template that how should we start this thing, how should we end this answer, but in between, what three words you have to use that should be taken from ChatGPT after putting all your information that okay, this is my personality, and tell me in three words how can I end this question, or how can I answer this question while interviewing. So this would be the best thing.
Yeah.
But again, yeah, we can just discuss about the qualities of the template and how can we answer that. So we have to answer this question like, thank you so much for asking this question. That's a very great, or you can just say that that's a very good question. I believe that you have a great pool of applicants, and who would be definitely since you will have a great pool of applicant, you have to like acknowledge that they have very good candidates. So you have a very good pool of applicants, and then try to add one more line just to appreciate all those candidates, and then you start your that. But I think that I would be the best fit to your program because of my this, and this.
Yes. Yeah. Okay. That's a perfect way to answer. Thank you so much, Dr. Suraj. Yeah. Exactly. Like, yeah, we are even acknowledging that we are not very special, but yeah, then we are mentioning about our strengths that what we can contribute to your program.
So for that thing, there's one more thing that you have to do is homework to look into the program's aim and mission.
Yeah.
That what program has been focusing on, what kind of residents you want. So I mean, two of the qualities can be from your personality, and third of the quality should be from the program's aim and mission. That okay, this is the third quality that you have been looking for in the candidates, and I have this quality. That's why I'm a best fit for your program. So program will think that okay, you have gone through their website and you personally like them. If you just tell your things, your three things, it's not going to affect that much. If you just add on one more thing that is that program has been looking for, and it is mentioned on their website, so it's going to give a very long lasting impact, and they might remember you.
Yeah. Even like I can just add one more point. Yeah, that's what you do. I think we just discussed that question last time and you were there as well.
Yeah,
Yeah, we just discussed. Yeah, so you have a lot of good points to mention, and you're very experienced as well. You seem to be very, very experienced too.
this is the second cycle, so
Yeah, but that's good that you're sharing your experience with us for sure.
Yeah, thank you,
thank you.
Suraj. Thank you for sharing your experience with us. So basically, what Suraj is saying is we integrate what are our strengths
Yeah.
and what the program strengths are. And in that way, how do we make a mutual fit?
Yeah.
Exactly. So you
So,
can just,
wow.
I mean, of course, you have to say your things more. So if you're telling three things,
Mhm.
at the end, it's your choice if you want to tell them five things. But I would go with the three things only because that's what they remember most. So if you just tell them three things, so from those three things, two should be your personality traits that you think that is your strength. So, for
Okay.
example, if you have a public speaking skill and that is your
Mhm.
strength, so you can tell that program that okay, I agree. I believe you have a great pool of applicants, and all of them would be very good. But I believe I would be a best fit to your program because of my public speaking skills. The second point, you can talk about anything that you have already mentioned in your CV and personal statement. And third point should be from their website that what they are looking for. So,
Okay.
I mean, it's very difficult to concise the whole answer in three words, like all your personality traits in three words. For that, you will take ChatGPT's help. That okay, this is my three traits. What would be the best word for these three personality traits? He will give you the buzzword that this is the perfect word for that. These kind of traits, and in this way, you will dig out three or four words, and then you have to see which word fits you best.
Yeah, exactly. That's very good point. And even like I can just add like even if we can just I can just go like if I am interested more in being a hospitalist or primary care. Suppose the program is more in its curriculum more involved in the primary care. Even my future goals are aligned with the going into primary care. I can just say, I just feel that your program, your curriculum, you focuses more on this particular aspect that I'm interested in. So it will help me to learn a lot and go and specialize in that particular field.
Yeah, so
Okay.
that's a great thing that after telling your three strengths and then try to explain only one thing. For example, if the program has been more of a community type and he's focusing on and most of the program who are in community program, they are focusing on hospitalists. So you can tell them, yeah. So after telling your three strengths, you can, I would like to add something more. I mean, after telling your 3 points, then you can add on like explanation line that since I have seen your website that your program likes to keep the residents of the hospital, and your program likes residents who wants to stay here in this city. So this aligns with my goals because I really like this city, or I have my friends and family in this area. Yeah, so this completely aligns with my goals, and I would like to grow up my family in this city. This way, you can end up the same.
Or you have even any fellowship goals and that program offers that fellowship, you can even mention that your program even offers a fellowship, and I want to pursue my fellowship after doing my residency. So even that, like that aligns with my goals, and I would prefer to work at your program. Something like this, you can just come up with a multiple points. So yeah, that's what even the family and friends is a very strong point.
Yeah,
Like,
about fellowship and research, I think we have to look to the programs. If they are offering, we can talk about that. Otherwise, no.
Yeah.
I have a question.
Yeah.
If we are interviewing, giving interview to a community program, and they ask me what will you do in the next few years, and we say to them that we will be a hospitalist because they do not offer fellowship programs. So, in order to stand good, we say to them that we will be a hospitalist. And if they ask why would you not do a fellowship and want to be a primary care physician or a hospital, then how will we answer that?
It's simple. I mean, if you have put your strength as a leadership, or maybe if you have put your strength as in public speaking, or if you have a previous experience of home country experience, then you can just end up saying that because I'm very good at maintaining the long-term relationship with the patient, so that's why I feel like I'll be the best fit in this field rather than going into the fellowship.
Oh, I
But
agree with Dr. Suraj, but we
fellowship,
can also mention that this is according to my current situation. This is what I think about doing. This is my current goal, but I am open to changes once I get in and I get experience in the other rotations. I might learn new thing and my goals can change. You can mention
Yeah,
that as well. You don't have to
that
be good, solid hospitalist thing.
you just have to be
that
diplomatic. Yeah, exactly.
yeah. So let me correct it. So this the answer that the last answer, it should be your answer when they ask that where do you see yourself in 5 years or 10 years. So these are both different questions. Bushra asked a different question. She asked that if I tell them I want to be a hospitalist, and program asks that why you want to be a hospitalist. So then you have to tell them that okay, I like to be involved with all the fields of medicine like cardiology, nephrology, and I don't want to go a particular field because I like to explore all the fields. Then you have to answer this. But when they're asking that where do you see yourself in 5 years or 10 years, then you have to be diplomatic that first of all, I would like to focus on my 3 years training. I would, and people's plan change with every time. I don't know what's going to happen in next 3 years, but I will be open to all kind of opportunities. I'll try to explore different fields. If I feel like I'll be the best fit in any fellowship, then I'll try to pursue that. Otherwise, I'll just stick to the internal medicine as a hospitalist. So you have to be
no,
very
actually,
diplomatic when they ask
that
where you
was
see it.
not my question. I was actually asking that in a webinar, people used to say if you are going to interview at a university, a university program, and they offer fellowship, you would say that I will do fellowship. But if you are interviewing at a community program, don't say fellowship because it will look bad. Just say I will be a primary care physician or a hospitalist. So I want to ask this: if they ask me further that why you want to be a hospitalist or a primary care physician, then how will tackle that?
That's what I told in the first answer, that you have to say that because you are very good in maintaining the long-term relationships and you like to explore all the fields, you like to taste the flavor of all the internal medicine fields like nephrology, cardiology. So you feel like being a hospitalist is going to challenge your analytical skills, and you can explore more being a hospitalist while experiencing all the fields like cardiology, nephrology, infectious disease. You're a good team player. That's why you love to be in contact with all other fields while taking care of a patient. So this is the diplomatic answer that you have to give when they ask that why hospitalist. Because being a hospitalist, you will be in contact with all other doctors. You'll be in touch with cardiologists. You'll be in touch with nephro. You'll be in touch with GI, pulmo. Everyone you'll be in touch with.
Basically,
So
you
there you can.
yeah, that's a very, very good point.
So I mean, there you can just tell about your strength. If you have put your strength as a teamwork, so you can say that because I already explained that I'm good. I work well with the team, so that's why I want to be a hospitalist, because I know it is very challenging for the hospitalist to be in touch with all the all the medicine fields while taking care of the patient, and I feel like I'm the best fit for that, and you want to explore all the fields of medicine. So such kind of answer would be a, I mean, it will not harm you.
Yeah. So yeah, exactly. That's a very, very good answer to this. And you can just start with maybe if you have some experience working in a hospitalist with a working in a hospital with a hospitalist, you can even add that I liked how they worked in a team. So with that, and then you can just continue with this answer. Like you are like if somebody wants to be a primary care physician, you can just write I worked with a primary care physician and I really liked it, and then you can come up with your reasons.
Ayushman, isn't that almost similar to why did you choose the specialty, isn't it?
See, yeah.
Isn't it? No?
At the end of the day, questions are very similar. As
Mhm.
somebody told, the questions are very similar. Nobody, if they're going to ask you like why you wanted to be a doctor, it's very unlikely in the same interview they're going to ask you why I am, right?
Right.
They can ask you why I am or why doctor, right? Because they're not going to waste your time just to know why you wanted to be a doctor and why you wanted to be into I am.
Right. Right.
Right, so they can just ask you like as Dr. Suresh told, the question is very similar, like why you are a correct fit for the program or why should I take you for the program, and when you talk about your strengths. So if they talk
Right.
about your strengths, then it's very less likely they're going to ask you the similar question that
Right.
why should I take you.
So we are probably discussing the different ways in which they would ask, and ultimately the whole interview uh, is all about letting them know in whether we would be a good fit for their program or not.
Yeah, exactly. First, they want to know that exactly you're a like. First, they want to know. That's what a psychiatric resident told me when she got an interview at a hospital. She told me that they want to know. They want to have a general conversation with you, right? They would just want to know whether first you're sane or not, right? And whether you're then second point is whether you're a perfect fit for their program or not. And the third thing they want to check that what you have mentioned in your CV, like people mention a lot of experience. Even I mentioned experiences, whether I have worked in those experiences or not.
Credibility, right?
The credibility of whatever I mentioned.
Right.
Right? I hope that's right, Dr. Suraj. Do you have anything to add?
No, I guess that's all. I mean, so there will be different questions who has the same answers. So as we already discussed that when they're asking that why should we choose you, it's almost the same question as it tell me your strengths. Yeah. So and even if sometimes they ask you tell me three things that define you, that is also the same question as in tell me your strengths.
Right.
Or yeah. So I mean, just be prepared that they can ask one question in different ways.
Right. And
Yeah.
for the question about where do you see yourself in the next 5 years or 10 years, that question was, of course, I think you all have the video. Dr. Suraj has already posted the one which Dr. Vijay had organized earlier today. So in that video, you can check out the answer, guys. They have in detail, they have explained how we can best answer the question, where do you see yourself in the next 5 years? It's not just the professional aspect, but they would like if you add a personal touch to it. So what might be your goals on the personal front? Just see the video, you will get a clearer aspect.
I'll ask, like, I don't think he has posted the recording yet, but I'll ask for the recording because I have to see it. I was busy at that time, so I couldn't attend.
Yeah.
But
I have seen even when they ask about the 5 years, so they are not just asking that where do you see yourself 5 years after, like medically, where do you see yourself? They're asking as a personal, as like personal growth as well. That
yeah,
where do you see? So you can just divide this answer in two ways. That professionally, I see myself here. I mean, if you want to be a hospitalist or whatever way you want to be, so you can just say that professionally, I see myself working with. I mean, if you're not impressed at hospital, so you can say that being my goal as a hospitalist, I see after 5 years, I see myself working with the leadership of XYZ hospital where you are interviewing. So that would be a great impression that you want to work with the leadership of the same hospital where you're interviewing. So they might get impressed, okay, that you want to be stay with them. And you can say that I want to work for the community of this suburban area. This is my 5 years goal, and personally, I see myself. Then people add on different things. Those who are not married, they say that we are looking forward to get married, buy a new house, buy a new car. Those who are married, they say we are looking in 5 years. I see myself as a parent, buying a new home, buying a new car, and these are the real things. I mean, if we see that most of the AMGs, they answer like it. They say that professionally I see myself growing here, and personally I'm seeing myself growing at this level.
Yes, that's right. That's exactly, I mean, that's very similar to what the AMGs suggested we should answer in today's video, which Dr. Surya has posted. By the way, Dr. Surya has posted it in 2024 IMG interview prep group. Everyone, this is just for everyone's information.
I'll just check that out. Yeah, thank you so much. Yeah. But I think we just came up with this. You were even there, Dr. Suraj, when we came up with this question, and you told about the similar points. Because
Yeah, I'm sorry. Go ahead. I'm sorry for interrupting. Yeah, go ahead.
no. I'm saying that we discussed a similar question. I think you were there at that time, and you just told us how we can frame our answer, like professionally and personally again. Like, yeah. So basically, we have discussed all the questions in the previous sessions. It's just like we are just to maintain a continuity. We do the sessions. Thank
Yeah, I
you.
mean it's always like that. So whenever they put you in, I mean this was a simple question where of course you will answer in both personally and professionally, and that looks more better, I guess. So because program wants someone who has a personal life as well. They just don't want a
Exactly.
doctor who's just been just working and working. So you
That
can
is
add on this even if you can if you have started any new activity or new hobby, you can talk about that as well. That I see personally myself being a champion in this thing as I have just recently started learning this thing. If you are like learning anything new, so you can just tell about that thing as well, that I see myself excelling in this thing as well personally. So try to add on those things apart from professionally as well. And apart from that, in behavioral questions, I mean, this is not the topic today, but I'm just giving a hint that whenever they ask you for any behavioral question, so try to be very diplomatic in that answer. And whenever I guess today's morning session was also attended by everyone, which was given by two other doctors. So uh, whenever they put you in any situation in behavioral question where you don't know the answer, or they ask you a difficult question like tell me about a mistake that you have made in your life, so they are not asking that tell me any mistake that you have made during your rotations or internship or during your career. They are asking that being a person, you would have made a lot of mistakes. So just tell them a minor mistake and what you learned from them. Don't go for the extreme of that mistake. So that can go against you. I mean, you are being honest in telling you your mistake, but don't be so honest that you just end up messing with that. So just try to tell them a little mistake that we all have been making, and always try to own your mistake. Tell them, yeah, I own my mistake, and I tried to rectify my mistake like this, and I learned this thing from my mistake. That's it.
Absolutely, exactly. We just don't want to tell them what blunders we ever did. Though everybody didn't do blunders every time, but yeah, we those who did, we don't want to mention that over there and show us in a poor light. But that's
Yeah, we don't want to be brutally honest.
yeah.
I mean, yeah, on the face, they won't say you anything. They will appreciate it. Oh, yeah, you did this. You
Yeah.
learned this thing. But on the back, they will be just like, okay, take him out.
Absolutely, yeah.
That's true.
Can anyone share any valid points of what mistakes they have done on how were they overcoming that or anything like that?
It could be, I would suggest that it could be any routine mistake you can talk about. It's not like that. So you can just talk about that. One day you remember that you forgot to lock your home. I mean, yeah, you forgot to lock the door of your home, and then while heading to your any destination, you realized in the mid of the way you realized that you forgot to lock the door, and you just came back and just locked it, and then you realize that after every time leaving the home, I should check all the doors that they are locked and the gas is closed. So I mean, you learned from that you have to check everything. This is just common mistake. Everyone does that, and there is no negative thing in it. So you can put this thing as a mistake and just try to take out anything which is very common and you learn from it, and that's it. Don't go personally, like in medicine, I made this mistake.
Yeah, something from your personal life, like something you can mention apart from the medicine. Yeah.
And then integrate it to how you can apply it to your medical practice. Bring the connection.
I mean, if you can, then it's good. Otherwise, just there should be a learning point of that mistake, what you learned from that. So it's not necessary that only there should be you should relate it to the medicine. You can relate it to your personal life as well, because apart from a doctor, you are a human as well, and your personal growth is also necessary. So you should include that as well. That personally, I learned this thing, and it helped me to grow personally. I learned from this mistake, and now it helped me a lot to grow personally.
Absolutely. Yeah.
Thank you. Thank you so much.
Even if they ask you like any mistake that you felt that you did in your medical field, then we can just come up with something that we discussed yesterday, our ethical, where we felt our ethics were compromised. Instead of telling that we committed a blunder, but I feel that I was in a difficult situation at that time, and we can just come up with like what as we felt our ethics were compromised at that time and how we learned from it.
Exactly, exactly.
I want to ask a question. Sorry. So a mistake such as previously I used to be someone who kind of makes assumptions a lot. For instance, I call you, you don't pick up your call. I mean, as you don't want to pick up your call. You're dodging me, something like that. Then, of course, as time went on, I grew from it. I went through some management, like emotional intelligence kind of tutorial and all those things, and I've grown from it, and I kind of want to also bring it to my workplace, where I would try to always give people the benefit of doubt, and also not like make excuses for everybody. I don't know if that will pass.
So Angie, are you saying, like, correct me if I'm wrong, from what I understand, you are talking about having a high emotional quotient, having troubles because of being too sensitive emotionally, and hence you decided to work on it and steer it towards bringing a balance in such a way that it stabilizes your personal and professional life. Am I right?
Exactly. Sure.
That's
sure.
a good point.
You've made it better. Thank you.
Yeah,
Thank you.
absolutely.
Yeah, even Angie, that's your kind of, that's even like when they asked you about your weakness, you can even come up with that point that you felt it was your weakness and how you overcame that, right? And how you that's even a very good point. Like that will be a different kind of weakness, that means that you acknowledge your high emotional quotient, and then how you overcame that, like whatever you did for that. So it's a very good point. Yeah. So for me, like if somebody asks me what mistake I made, like I feel that I could correct it later. I could ever, if I ever get a chance and I could correct that mistake, I would just say that maybe I should have taken care of more of my health apart from just going for studies. right? Because in my 12th
Oh,
standard, I gained a lot of weight, right? Maybe I was 140 kgs, right? Then when I
oh,
entered medical school, I lost 25 kgs. But still, I was down to only 115 kgs, and I still have to work on that. And with time, I just feel that I should have given more importance to my health apart from my professional life. Like for me,
okay. So
that would be my
okay,
personal.
now, so how, yeah, I like the fact that you mentioned that you've dropped some, you've lost some weight. So how do you now want to go from there? Like saying, because I'm also on the big side. So how do you want to go from there saying, oh, okay, what are the plans that you have in
I am.
place?
I can just
Okay.
say that right now, yes. At one point of time, I had I had given like more time to my studies because they were more important at that time. But now I'm currently
Okay.
working on that. I go for swimming 5 days a week, and whenever
Oh,
if I work, wherever I work, I try to go for to gym at least 3 to 4 times a day, right?
oh, great.
And I want to be in a good shape and be more confident about that. And I would
Oh,
never
good.
I would never just compromise on my health in future. Like that's what I feel is my weak point, very weak point, because losing weight makes me more confident. And so yeah, that's very that has impact on me as well. But yeah, I can just tell them that I lost this much weight, so I have a kind of perseverance to lose more weight, right? And I can just say I'm working on that, and maybe in coming, like maybe 1 or 2 year, I will be in a good shape. And I
Okay,
just try
good.
to be more active, going to swimming or going to gym. So that is like I can just show them that I'm even active. My weight is not my something that's going to restrict my ability to do anything. Plus, I'm working on that.
Oh,
And
So,
perfect. Thank you. Thank
yeah,
you.
yeah,
I just have a different opinion. I mean, I'm just seeing it as a strength, Ayushman, because you've been open to improvement. You are extremely self-aware. The moment you identified that, this is not going right, this is not going good for you, you identified it, worked on it, and you got better. I
yeah,
would see it as a strength, but yeah, up to you the way you present it.
yeah, it's definitely one of my strengths. But I can, if somebody asks me like, what was the one thing you want to change in your life, or what do you think was the biggest mistakes of your life, I can even mention over there as well.
Um,
Like, yeah,
And on a lighter note, like you can even say, like, I want to follow the advice that I give to my patients. So that way, like, you're kind of bringing it back also.
absolutely. Yeah,
Okay.
that's a good point. I can just tell that I want to give the similar advice to my patients as well, so that they can even have a like we can have a like people can have a good health in future as well. Yeah,
Yeah, because it's always been a problem for me. Like when I want to give my patients lifestyle advice, I
then I
always
look
like
at
want to
myself.
think twice, thinking like looking at myself first. Wouldn't they think, oh, what if you knew all this? Why are you like this? You know.
No,
I
Okay,
mean,
I
thank you guys
get
for
if,
it.
that.
if hypocrisy had a face, it would be me at that time. So
Yeah,
No. Hey, trust
yeah.
me, guys, as doctors, we are the worst patients ever, okay? We are extremely good at giving advice to people, but we follow less than 50% of what we preach.
Very true. Very, very
Dr.
true.
Sapta, you want to go ahead with your answer? Sorry I interrupted you at that time. Like I didn't
Yeah.
realize. Yeah, just go ahead with your answer.
What a question do you want for me?
You want to answer whatever question, you can go ahead with that answer.
Yeah. Okay, the first thing I have prepared my own answer. So, like, if you want to ask me what you uh, for that question, where you are going to see yourself in 5 years, I just appreciate, I think, Dr. Suraj, how he mentioned, like, to categorize both professional and personal thing, because it's true. Even I have observed AMG, they don't exaggerate and they don't portray themselves as like the Mr. or Miss Perfect. They just say normal things. So I will definitely add the personal things, and in that column I will add my creative writing skill. I will say, like, apart from my like, professionally, I want to see myself as a neonatologist, because that is my area of expertise, if that is a university program. But personally, yeah, definitely I want to get settled with my fiancé in this next 5 years. And another thing is, um, as I'm more inclined for pediatric leadership and pediatric advocacy, I want to contribute my time in these areas for better community service, better medical educations. I want to see myself as a pediatric leader and interested to work with more leaders. Another thing is I'm writing nowadays like a I'm writing my own stories chapter wise, because I'm from a privileged area, unprivileged area, and I'm the first USMLE aspirant from my native place. So I'm interested, and I'm hoping to publish a book in next 5 years. That is definite in both English and regional language. That is going to be motivational and helpful. Students like me who are from underprivileged area with financial constraints to see dream beyond their capacities and beyond boundaries. So that is my like something I want to do. That is the next 5 year wala question. And another question, what to say, weakness. In that
Just a
weakness,
second, just a
yeah,
second. You speak really well. Your answers are well drafted, right? Kudos to you for that. But just try to frame that in a right way so that you don't take more than 90 seconds. Just try to
yeah, yeah,
reduce the
yeah.
length of your answer to 90 seconds. Otherwise, your answers are so well drafted. Like I have never drafted my answers that way, right? Your answers are very well. They're very good.
Yeah, I'm just saying my own way. It's not drafted, but I feel I have a good
You have done
communication
your good
skill.
research. You have
Uh,
done your good research, right? So
so,
Kudos to you, Sapna.
answers
Yeah,
are
that's very good.
so
You
that is
sounded
something.
really good, Dr. Sapta. Really good.
Thank you. Actually, this is my first session. I was just traveling. I just reached India today, so that's why I'm just trying to be more active from now onwards.
perfect.
So before that, I was not active in the group because of traveling.
Okay. Yeah, just go ahead with the next answer.
Next,
Just
I
one
think,
thing, Dr. Sapta, one
yeah,
thing, sorry to interrupt you.
yeah, yeah, sure.
Like everyone said, your points are very excellent. Just one small suggestion for you is like try to categorize your answers. Like just for
Yeah,
the previous answer as an example, like try to finish all your professional and then go to your personal. Like if you go professional, personal, professional, then it kind of they feel kind of confused and they cannot
yes.
follow your train of thought. Then though all of your points are very good, if you categorize them, I think it'll be even more impactful.
Yeah. And
Okay.
you just don't need to attach example to your every answer because you don't have to, just answer about one only question during the interview, right? So you just have you just attach like as you mentioned before, it's 90, so 3:1 rule. Like mention 3 points, right? You can just have 10 points in your mind so that you don't fall short of the answer during when you answer during the interview, but you just have to mention only 3 points at that time, right? And you just attach an
Okay.
example to only one of them so that your answer is short, crisp, and good because you have a very good content.
Okay. So another question is that you have asked why the program would choose you. There I have 5 6 points. I'll just say, and you people please guide me what 3 points I want to say. So first thing I will definitely talk about. I have a strong clinical and working experience in pediatric because I have completed my residency and post residency work in India. And through this extensive training, I have seen diverse varieties and rare varieties of cases. So definitely, I want to bring that experience to the table. Another thing is pediatric leadership and advocacy. To be honest, I have inherited this skill from my family. So I love taking initiatives, taking responsibilities for managing events and all. Even during my residency time, uh, I was doing the academic rosters. I have presented mortality and morbidity meet. So that skill definitely I feel is going to be helpful for the program. As a creative person, I would like to make posters, flyers, presentations, and also I would like to use this skill for raising social issues, medical issues through my writing and service. So definitely, I would love to deliver the message of the program and the hospital through my creative skill in future. And I have a good communication skill, so I can use that skill for long-term patient relationship, even in different collaborations with organizations, with other departments. So that is something I want to talk. And at last, my friends and colleagues describe me as a fun-loving and charming person. So I would like to use my creative skill like music, dance, culinary skill for entertain my other team members, because residency can be stressful sometimes. So I want to relax my teammates also in a lighter note. So these are few qualities for which I feel the programs should select me. I mean, I don't know how to frame it, but if anyone want to say something.
You just mentioned all your good qualities in that answer.
Yeah. So can I?
Sometimes I feel I'm very greedy person. I don't want to stop. I want to say many things.
And then let
Yeah.
Dr.
Okay.
Suraj give you the feedback. Yeah, go ahead.
Yeah. So Dr. Sapta, I really like your answer. I mean, you have great things to say. But you have to, of course, concise it. And of course, again, the same thing, rule of three, go for that and choose the three best of the things. But one thing that I was missing, of every program director might think it like that, that she already has done her pediatric residency and she knows everything, then why she want to come here? She will not be open to learning. So you have to add that point, that though I have completed my training in pediatrics there, but my passion for learning is always open. So while I join your residency, I'll of course use my previous experience in your training, but I will always be open to new learnings and foster criticism. So in this way, you can frame it in a much better way, because I heard from somewhere that they were saying that if you're telling them all your good things, so they will think like you're perfect. Why you want to come to our program? So you have to show some leniency there, that you are still, you have completed your
Yeah.
residency. That's a good thing, that you will bring that experience to the program. But then add on with that thing that you will also be open to learning to the you will always explore the new horizons of that field. If you're applying to medicine, then medicine. If you're applying to pediatrics, then say that pediatrics. So say these three words, two, three words, that open to learning, open to feedback, criticism, to improve my things. Though I have completed the residency, but still there will be a lot of things that I need to improve that lack in me. And that's why I want to take this opportunity to improve myself more and more day by day. Rest of the things were very good, I guess. Only this thing was missing, that
Yeah,
that I already
definitely.
told you. And
Thank you.
apart from that, just try to concise it, and like only take three experiences that you want to bring to the program.
Okay.
Don't go for five, six. I don't remember what you said. If you have told three, I would have remembered those three. But you told five, six, then I don't remember them. I would hardly remember one or two. So it's better to go for three and tell them three. That also I
Yeah.
learned in a video, that whenever you're telling, so before starting, just tell them, here are my three qualities that I will bring to your program. Then he will be counting, okay, this was the one, two, and now it's going to be the three. But if you don't tell them the number, then he won't be counting and he won't give much attention. So this is just a way to catch their attention.
Yeah, that's
Yeah,
true.
I
Yeah.
agree with
That's
what
a very
everybody is
good thing
saying.
to say. Yeah.
Dr. Sapta, you have a very good point. As in, I was able to follow through, as in, and I was really amazed with everything you mentioned. But like what they've been saying, just keep it to three most important things and
Yeah.
make it short, because sometimes they might get lost in between whatever we're
Yeah.
saying. And the first point is a very, very good one. It would really make you stand out, like your clinical experience and all that. Then you can add any other things there.
Yeah. So
Okay.
I have a question for Dr. Suraj. Please,
Yep.
you said okay. You said here are the three qualities that I want to bring to the program. So would that be all the three that we earlier talked about, or your three personal qualities like merged in one? Or okay, I think I get it now. It's all the three that we earlier talked about, because you talked about the rules of three, right?
Yeah. And there's the
Or
same question as in your strength. I told that we already discussed that they can ask us one question in different ways. So what are
okay.
you bringing to our program is the same thing. What is your strength? I mean,
Oh, I
most of
see.
the things will be same. You can change. Okay, this experience thing you did not include in your strengths, so you can just change that one thing. Otherwise, two of the things could be the same from your strength.
Okay. Okay.
Yeah,
All right. Thank you.
And when you prepare the
yeah, of
answer, just
course.
don't prepare the 3 points only. You can prepare 5, 6 points so that when
Hmm.
they ask you, you can just talk about 3 points at that time. Maybe you will fall short of if you just prepare three, so you might not remember all those 3 points, right? So just prepare more.
Yeah,
Yeah.
Don't speak more. Like just concise it to only 3 points, as Dr. Suraj told. Remember the rule of three. But when you draft the answer or when you prepare that in your mind, you just have more, points in your mind about that answer. Don't just stick to three strengths. When that you will prepare only three strengths. You can go with 5 or 6 strengths. But when they ask you the question, just you can just mention about the three of them, because if you prepare only three, it might be like you only remember two of them or one of them during the while when they ask you, right? So the more you prepare, the at least you will remember three of them to discuss during the interview.
yeah, that's very true. So I would say that whenever you're making your pointers, just try to write down like 5 points, and your top 3 points should be that you want to talk about, and the rest of two would be your backup points. If you forget any of the points, so they should be in your mind. So in
Absolutely.
this way, you have to make your pointers.
So it's wonderful to have you. Like you have too much knowledge to share, and you're too experienced. Thank you so much. Like absolutely
Please,
told the very right thing that
we are
you
we are
really.
all together in this. Don't worry. I mean, it's just a learning, sharing. I'm also learning from you guys and then sharing my things. So it's just a give and back thing. Don't worry for that.
Yeah. So Dr. Reddy asked, what do you think you will contribute to this program? Any suggestions for this question? So anybody can just concise 5 points, like just quickly, and then we'll end with the meeting.
Any suggestion of what do you think you'll contribute to this program? Okay, so again depends program to program. If that's a new program, then you'll answer it in that way. So if you're interviewing in a new program and they ask you how would you contribute to our program, and if you have already mentioned about your teamwork or maybe leadership skills, then you can one of the point could be that with my previous leadership skills, I would highly appreciate to take part with the program's leadership. Uh, to making if the program has been working on any new changes, I'll definitely give a helping hand to the program leadership so that we can take the program to the new heights. One of the thing could be this one. So I mean, you are just telling them that your leadership qualities can be availed here. And the second thing could be your experience, of course, if you are giving a new program, that I'll bring a new experience. So of course, if my colleagues have any problem, I can share with them my experience, and I will have the opportunity to learn new things from them as well. So that could be one of the point that you can tell. And the third could be,
Like you could
um,
just say, like, I can
that
bring my adaptability, my efficiency to the program. Like you can just talk about, like it's
no,
again.
he's saying after contributing. Contributing is like, so maybe you can talk about if you have done a lot of volunteer work. So you can say that I can help the program in arranging different seminars in the community for the preventive or screening things, seminars or preventive uh, campaigns. I can help the program arranging the preventive campaigns, the screening campaigns to help the nearby community. In this way, you can help the program. So the first, second, and third point can be used in every program. The first point that about the leadership qualities that you want to work with the program's leadership to help the program achieve the new heights, that can be used for
Program.
only new program. And you can also set, you can say that you want to work with the program, you want to contribute to the program in a way that you want to work with the program leadership to set the new standards for the program for the incoming residents so they feel like a family here. That could also be said in the new program.
Yeah, absolutely. And like if you vouch for the mentorship, you can say that I can mentor students and the incoming residents as well in the future. Because like if you have any mentorship experience or you like doing a mentorship, something like that. So yeah, these are very good points.
Yeah, of course. I mean, that's just mentorship point. And if you are teaching, if you love teaching, and if you want to go to the academic side, you can say that point as well.
Absolutely, they are like, yeah, they're really good points. So I think we'll end the meeting because we are 1.5 hours into the meeting, and then we can just discuss the question and we'll post in the group tomorrow. I'll post in the group or somebody else will post in the group, and then we can meet tomorrow by 9. So we have covered a lot of questions today, and thank you so much, Dr. Suraj, and everybody who joined here for, and Dr. Sapta, Dr. NG, everybody out there. Thank you so much for participating and making the meet very interesting.
Thank you
Yeah,
so
I
much.
feel it
Thank
all
you,
was
It was
everyone.
new,
very
and
insightful.
we
Thanks.
also don't know.
Thank you, everyone.
Thank you so much.
Yeah, thank you, everyone.
Okay. Good night or good have a good day depending on your time zones, and see you tomorrow.
See you.
Bye.